The U.S. death toll in the coronavirus pandemic has now surpassed 250,000 people, by far the highest national toll worldwide. Infections are soaring to new highs across the country. New York City was the epicenter of the U.S. outbreak earlier this year. Now it's decided to close all public schools again as it fights a resurgence in the virus.
It's an unseasonably early last week of school for children across New York City. Classrooms are shifting to online learning until further notice. It's the latest in a series of new restrictions in the state. Parents and students alike are unhappy.
It's super unfortunate that these kids are going to be denied an education, but we can go eat dinner inside a restaurant.
For tomorrow to be the last day of school, it kind of sucks.
We're a little sad it's closed, but if that's what's best for the kids, we'll go with it.
The city's mayor feels the same way.
I want to affirm that as much as we are unhappy today that this moment was reached, we are resolved to keep fighting. That's what New Yorkers do, and we will overcome this moment.
Cases in the state have more than doubled over the past 2 weeks. But New York isn't the only state to see an exponential rise. Caseloads across the country are increasing, as are new restrictions. Deaths have also been mounting, passing 250,000 since the start of the pandemic. The president-elect is warning even more people could die if President Trump refuses to share crucial information with the incoming administration.
In front of me, over 300 million Americans and beyond our border that are going to have to be taken care of. And there's a whole lot of things that we just don't have available to us, which unless it's made available soon, we're going to be behind by weeks or months.
Even as promising vaccines raise the hope of an end to the crisis, the country will still have to endure a long winter.
Well, for more, let's bring in Dr. Peter Chin Hong. He's an infectious disease specialist at the University of California, San Francisco. Dr. Chin Hong, more than 250,000 deaths. How did things get this bad in the U.S.?
Well, it's a combination of factors, Terry. There is colder weather, so more people are drawn indoors. There is pandemic fatigue, which some have recoined pandemic resentment. And of course, people are still in search of a national strategy. We still don't have one. It's several months, many months into the pandemic, and we're only as good as our neighbors, given the fact that we have very porous borders between states.
Now, there are two highly effective anti-COVID vaccines on the horizon. They could be approved possibly in a matter of weeks. What are your expectations in terms of impact from those vaccines on the pandemic in the U.S.?
Well, Terry, I think I would approach it with very cautious optimism. I think it'll be some time before much of the general population sees the vaccine. Of course, only about 50 to 60% of Americans, by the latest poll, are even willing to stick their arms out to get the vaccine tomorrow. But we will be doing it in tiers with the healthcare workers and first responders first, then with folks who have comorbid conditions and the elderly.
What's the situation in your clinic and others like it when it comes to treating COVID-19 patients? Do you have the resources you need?
Well, we've been stockpiling masks. We've been stockpiling drugs like remdesivir over the last few months. But I still think we will run short in certain key areas like diagnostic supplies. There've been a run on individuals trying to get COVID tests, and we're not able to keep up with demand right now. But I would say it's the calm before the storm, and we expect a 2-week lag between what we see in the community in terms of cases and what we see in the hospital. Hopefully, we're not going to get overrun because we only have limited beds.
President-elect Joe Biden is warning that more people may die if Donald Trump continues to block transition planning with the coronavirus. What do you make of that?
I think it's a very realistic statement to make, given the fact that, even as something as as key and vital like the vaccine rollout, like you described, Terry, is up in obscurity right now because we don't know how the military is going to be involved. The new administration doesn't know how the refrigeration or the freezing is going to be rolled out because, as you know, both of these mRNA vaccines require very cold temperatures to get to the arms of the patients who need it. So all of these key details are missing from the new administration, from the public health officials.
Dr. Peter Chin Hong, the infectious disease specialist at the University of San Francisco in California. Thank you so much.
Thanks so much, Terry.
Well, in the U.S., the Food and Drug Administration has given emergency approval to the first rapid coronavirus test that can be done at home after a simple nasal swab. The result, positive or negative, appears in about 30 minutes. This test does require a doctor's prescription, but it bypasses the lengthy process of waiting for results from a lab. Now, this is good news against a global backdrop of restrictions and lockdowns. Here in Europe, there is a patchwork of national responses to the coronavirus. Now, this map shows all of the countries that have imposed a partial or total nationwide lockdown. As it stands tonight, there are 17 countries that go from Austria, which began a total lockdown on Tuesday. You've got Germany, which is in the middle of a 4-week partial lockdown. Stores, schools are open, restaurants, bars, and gyms are closed. The World Health Organization says that more than half of new infections reported worldwide last week came from Europe. Now, the situation is worse in the United States. What we see here are the states that have issued a stay-at-home order, similar to European lockdowns. And as you see here, New Mexico is the only state that does that. They're supposed to be color-coded. New Mexico is the only state that is telling people that they have to stay home. Other states are advising that they do that, which is California, you see there, Kentucky, and then in the Northeast, we have the states of Massachusetts and Rhode Island. Well, the day's best news in the pandemic is a transatlantic story. The U.S. pharmaceutical giant Pfizer and Germany's BioNTech have announced that their coronavirus vaccine has passed all safety tests and trials. BioNTech's CEO says regulators in Europe and the U.S. could approve the vaccine as early as December.
Our safety analysis so far indicates that the vaccine is well tolerated. It could happen that we get an authorization until mid of December and could start to provide the first millions of doses of vaccines to the regions where we get an approval on authorization.
All right, for more now on the latest in the COVID vaccine race, I'm joined by Amish Adalja. He's a senior scholar and Johns Hopkins Center for Health Security. It's good to have you on the program. The Pfizer-BioNTech vaccine, it has taken just 10 months to develop, which is a remarkably short time. How can we be sure that it's safe?
We can be sure that it is safe because we've seen animal data, we've seen phase 1 and phase 2, and now phase 3 data. You have to remember that the speed with which this vaccine was made had to do with the fact that it was using a new technology, an mRNA vaccine platform. And that's where we cut the speed down. It wasn't that the safety was that there were corners cut in phase 1 or 2 trials. We will have to follow people once they're vaccinated for years, like we do with all vaccines. But in the middle of a pandemic, we're going to get an emergency use authorization based on the safety data that we have so far. And it does look good. I do think we have to continue to follow, as I said, to make sure nothing longer term occurs, but I do think everything is pointing the right way when it comes to this vaccine.
Amish, are you concerned that there are no long-term observations with this vaccine?
I'm not concerned in the sense that anytime we have a vaccine, it gets approved, and then we follow people out in what are called phase 4 trials. So when the HPV vaccine was approved, we didn't have 2 or 3 or 4 years of safety data, but we followed people even after it was approved, and it ended up being safe. I don't have a major concern. Most of the vaccines that make it this far don't usually have long-term consequences. I think it's important to study that, but to me, I don't think there's going to be a signal here. And I think that in the middle of a pandemic, you also have to weigh the risk and the benefit. And I do think that the vaccines, the way we're seeing them now, are are really, it's the benefit that's outweighing any risk that we have with not having the long-term data.
Do you plan to get the vaccine, Amesh?
I do plan to get the vaccine as soon as I'm in an eligible group. I am a healthcare worker and take care of COVID patients, so I may be in the first priority group. So I will gladly get this vaccine.
We know Pfizer and BioNTech say that their vaccine is 95% effective. And I know that they were ecstatic about that number, 95%. Why is that number so impressive?
The number is so impressive because we never thought that a first-generation vaccine using a new technology would reach those types of, that level of protection from symptomatic COVID. We were looking at 50, 60%. That's what we would have been happy with. But to see them really hit it out of the ballpark, 90% really made people take a step back and understand that this technology does have a lot of promise, not just for COVID, but for future infectious disease vaccines as well.
We know that vaccine denial is likely to be an issue on both sides of the Atlantic. There will definitely be some safety concerns among the public. How many people will need to be vaccinated to ensure herd immunity and to stop this pandemic?
It's likely going to be maybe 70, 80% of the population. If you assume that everybody has the same risk of transmitting the infection, it may be also the fact that we're not first looking at herd immunity here. We're looking to try and decrease the virulence of this infection to be able to stop people from needing to be hospitalized. So we may be able to give our hospitals breathing room before we get near that herd immunity threshold. So it's important to remember that this vaccine, because it is so effective, is likely to really be able to take the pressure off of hospitals and take the pressure off ICU beds and ventilators. And that's really what's driving a lot of the public health concern about this virus. That's what flattening the curve is about keeping it below hospital capacity.
How do you think governments and public health officials should deal with this vaccine skepticism that we see?
We have to really be as transparent as possible about the process that led to the development of these vaccines, what the clinical trials show in terms of both the safety and the efficacy, try to be able to answer any question that may come up, tell people what we know, what we don't know, and really detail them on all of the benefits that this vaccine may provide and help them make this risk-benefit calculation. We have to be proactive. We cannot be reactive because the anti-vaccine groups will already be going after this vaccine prior to its arrival.
You know, and from expecting too little to expecting too much from these vaccines, I want you to take a listen to what Mark Ryan said today. He's with the World Health Organization. Take a listen.
Some people think that vaccine will be, in a sense, the solution, the unicorn we've all been chasing. It's not. Adding vaccines is going to give us a huge chance. But if we add vaccines and forget the other things, COVID does not go to zero.
Amesh, are you concerned that once the first vaccine injection is given, are you concerned that we'll see people drop social distancing, stop wearing face masks, and let down their guard?
We're already seeing people let down their guard, and I do think that there is that danger. You have to remember that the vaccine isn't going to be a magic bullet unless it's coupled with a lot of other things until we get across a herd immunity threshold. And it's going to take a process of years to get the world vaccinated. So COVID-19 is not going to go miraculously to zero. We will still need to think about what measures we need to do to keep ourselves safe, especially for those who aren't able to get the vaccine or who the vaccine doesn't work for. And remember, not everybody's going to be in a priority group. So this is going to be important, that we have to get through this process by using a lot of the common sense things we've been doing from the beginning: wearing a mask, social distancing, washing your hands a lot. All of that's going to continue for some time, even when the vaccine is available.
Let me ask you, before we run out of time, the German health minister says that COVID vaccines will not be compulsory. Do you think that's a sensible policy?
It's going to be hard to make a vaccine compulsory when it's only available on an emergency use basis. I think once you see full licensure and a much more robust safety profile, then I think you'll see schools, for example, or employers making these vaccines a requirement as a condition of entry. But I think in the early rollout of this vaccine, it's likely going to be just something that's highly encouraged, but not something that we will really have a basis for mandating because of the lack of all of the long-term safety data, which we won't have for a couple of years, which then will lead to the full licensure of the vaccine.
Amesh Adamja at Johns Hopkins Center for Health Security. Amesh, it's good to have you on the show. We appreciate your time and your valuable insights tonight. Thank you.
Thank you.
Now we turn to India, where the capital, Delhi, is considering plans to reintroduce some lockdown measures following festive gatherings and a drop in temperatures. The nation as a whole is bracing for a spike in cases, but residents in Delhi have already seen the numbers go up. DW meets those at the front line of the city's battle with COVID-19.
The day is just beginning for Rajesh Ojala, but he knows it will be a long one. He counted 15 bodies in the morning when he left the morgue at Delhi's largest COVID-19 hospital, where he works. He will spend all day at this crematorium. He'll help cremate the bodies safely and ensure that people suffering the shock of losing a family member to the coronavirus have proper protective gear as they say their last goodbyes. For the last week, Rajesh has been bringing in twice the number of bodies than earlier. Delhi is experiencing its third spike in COVID-19 cases, with close to 100 deaths every day. Rajesh was assigned to the mortuary after many workers before him quit, overwhelmed by the number of corpses coming in.
I had to step over bodies to sort through the names of the victims. I had to summon all my courage. Of course, I was scared. I've never seen anything like it in my life. I've never seen so many bodies.
Still, he soldiers on. He says someone has to. Here at the Lok Nayak Hospital, Delhi's largest coronavirus facility, the spike is evident. The severity of the cases has also risen, as many more seek admission. While this hospital still has a high number of designated coronavirus beds available, they only have a handful of free ventilators and intensive care units or ICU beds left. This after ICU beds at this facility alone have been quadrupled during the pandemic. Authorities here are confident that things are under control, but they are also bracing for more cases.
More and more people are coming out of their home, so the number may go up. So we have to make a provision for that also. This is because of the festival time, that a large number of people are there in the markets, in the malls, picture halls, and social gathering.
The authorities are now mapping out ways to prevent the healthcare system from being overwhelmed.
With daily cases in Delhi crossing the 8,000 mark, the national government has now stepped in. Authorities plan to significantly ramp up testing, increase the number of ICU beds, and also deploy emergency healthcare forces.
Elsewhere in Delhi, though, the morgue and the ward are starkly distant worlds. Crowds continue to throng the markets. Residents think reimposing restrictions is unnecessary.
There's no need to worry. Cases are going up. They'll keep rising even during a shutdown. People go out anyway. It won't make a difference.
It's not so dangerous situation right now if we take some precautions, so it becomes easy for us.
Back at the crematorium, Rajesh strongly disagrees. His is the kind of work that makes him wince when he sees the markets overflowing and people crowding together on the streets. Memories of the lockdown may be fading for those out and about, but Rajesh is still afraid to come close to his 3 young daughters and his aging mother. But he is not giving up. Lockdown fatigue is not an option. It's only when the pandemic ends that Rajesh can truly go home.